context for people who might not have been here last time. In November of 2016, the State Board of Education adopted a resolution establishing the whole school, whole community, whole child model. For our purposes, we call it Whole Child North Carolina because it is our effort to bring together services around children, those wraparound services that are well researched and necessary. We know that the research is clear that if students have barriers to success such as health issues, hunger, issues at home, they're going to have great barriers to succeeding academically in our schools. I just said I'm most optimistic about this model and what it means moving forward for our state, for our students, because it truly is a way to bring all those services together around a child, no matter the circumstances, whether it's social work, mental health, all the services that are available in communities. And we are so happy today to have 3 of our districts here to present to us how they are addressing this. Last month we had, y'all will recall, we had Rockingham County Schools who came and talked about their student health centers and the great success they had had over 2 decades in Rockingham County, dealing with supporting students and keeping them healthy and ready to learn and getting rid of those barriers to success. I'd like to introduce first Dr. Ellen Essick, who is our Healthy Schools. I don't have the right title for you. Healthy.
Section 2.
I'll just call you the Healthy Schools section because you are practically the whole section. We don't have a lot. We don't have a lot of staff here, as every department here would say. But Ellen does a great job of leading the Healthy Schools section. And this work really comes out of our coordinated school health plans, and I appreciate Ellen's leadership on that. Ellen's going to take it from here and introduce Kelly, and then Kelly will introduce our presenters, I think.
Thank you, Ms. Willoughby.
And you have all this on your e-board, by the way.
Yes, you do have this, and good morning, Chairman Cody, members of the board. It's great to be here to have 3 more of the pilot districts share some of the work they're doing. I did want to share that about 1.5 years ago, our team was sitting around talking about the relationship between health and academic performance. And Bert, our only solid member that's still with us, he said, I wish I had $300,000 to use this model in a district and see what we could do to change some things. And so we started looking for some funding, and we applied for a grant, and we didn't get $300,000. We didn't even get $3. But what we did get was very valuable, and we got the support of this board. And that's been incredibly helpful to the work. Our team, like Ms. Willoughby said, has always incorporated a whole child approach to all the work we do. Bert, Les, Suzanne, Kelly, Keisha, we've always used that when we try to reach out and help districts to do their work, and that's been our framework. But the endorsement from this board, it's kind of rejuvenated that and given us this opportunity to go with districts and get them excited again because they know that somebody higher than cares about them and the work they're doing around this. So that's been incredibly exciting for us to work not just with the pilot districts, but with SHACs across the state. Kelly Langston has done an excellent job working with the pilots to help them look at their data, which they're just getting into now, doing some assessment and making some plans for where they want to take their work with the health of students in the future. And so with that, I'm going to turn it over to Kelly and let her introduce the folks that we have here today and talk a little bit about the work.
Good morning, Chairman Cody, members of the board. Good morning. I have to say good morning to my Guilford County colleague. It's great to see you on the board this morning. Thanks for having us here. It's an honor to be here with all of our pilots. And after a year of hard work, I'm going to drive this a little bit. Let's see. All right, I have to get fancy and use the clicker. No. All right.
Who is she? Kelly Langston. She's cool.
Doesn't want to work for me, Jana. I'm so sorry. It's user error. And it works for her.
Sure.
Well, I'll just keep talking. Is that okay? Okay, so after a year of hard work and researching what other states were doing and working and meeting with these amazing 11 pilots, Thank you. Ta-da! It works. I'm super proud to share a snippet of what we've learned. This amazing framework is really a great framework for how this agency educates our most precious resource, our kiddos. So by North Carolina looking at the whole child and these non-academic barriers to student success, we have the greatest opportunity to make the biggest impact. So the first thing we needed to do really was to work with the 11 pilots and build relationships and build trust. Obviously, these 11 pilots raised their hand without the promise of any resources because they believed in the work. They knew that there was something really meaningful about this concept. So we worked with the pilots, we met with the pilots, we went and visited the pilots, we saw what they were doing, we got to know them, we built trust. We helped the pilots build strong teams. We looked at the Healthy Active Children policy, and we really helped determine who needs to be on SHACs and are the SHACs represented fully. And we looked at the model, and this is a great visual of who should be at the table when we're looking at the framework of the whole child. We thought about what resources do we need, and so we really started. We have this great assessment tool. How do we look at all the data, the academic data that we have, and we have all of the non-academic data, and how do we look at it, and how do we get all these different perspectives to look at this data? And how do we make sure that the non-academic data is embedded into the academic plan of the district? So we have this assessment tool, and then we also want to make sure that these great pilots and all the wealth of knowledge that they bring, that they're informing these resources. So not only are we creating these resources, we're improving these resources based on what they're telling us. We have these monthly webinars that we can really help build capacity, because we have some pilots that are still really trying to form their teams, and we have some pilots that have rock star teams that are really at the next level. So we have a broad spectrum of where we are with these pilots. Regular communication, pilot collaboration, that's been really huge. You're going to hear them talk about some of that. The annual SHAC meeting, so they're able to meet with other LEAs. So the work that they're doing, they're sharing with the other LEAs. Site visits, and then of course our 1-year anniversary calls that we're starting. So you don't really want to hear from me, you want to hear from these rock stars. So I'm going to turn it over, and we're going to start with Scotland County, and I'm going to let them introduce themselves. So Scotland, take it away.
Okay.
And I'll give you the clicker.
Thank you so much.
Absolutely. Do you need help, or you've got it all passed out?
I've got everything is all set.
Okay.
Thank you, Kelly. Good morning, Chairman Kobe. Good morning, board members. Thank you so much for allowing us to be here today to talk with you about the great things that are going on in our districts. I'm Jamie Sinan. I'm the Director of Student Support Services for Scotland County Schools. We're going to start with an activity. So Ms. Townsend Smith had passed out some little packets for you guys. If each one of you will kind of look towards, she's already paired you guys up, and there's 2 containers with puzzle pieces in it. If each one of you will take a container, and you can go ahead and open it up and pull your puzzle pieces out. I'm going to give you 30 seconds to put this puzzle together. On your own, you have 30 seconds. Bounds is going to start the time. And let's see how well you do. So 30 seconds to put your own puzzle together. Go.
30 seconds. Where's my grandson when I need him?
You can do it. I promise you.
Let's see, got
I did
2,
one.
4 pieces. Okay, all right. I need 8.
Yeah, there are no
In
corners.
the corners, that's the problem.
This will be, and we have some that's just below the bottom.
I have some of yours, so I think that's going to be all right.
What's that?
I think I have some of the words.
Time's up. Okay, put your hands up.
And 15
So,
seconds.
just like on the Food Network, put your hands up. Okay, so how many of you were successful at putting your puzzle together? No one. Why weren't you successful? You have missing pieces?
Not enough time.
Not enough time?
Yeah.
But I gave you resources that I had. I gave you directives, and you weren't able to do it. So now I'm going to give you another challenge. With your partner, I want you guys to get together with your puzzle pieces, and you'll have 1 minute to put your puzzle together completely.
See, I see. Yeah, green, green, no. Alright, and then, so this is a piece, and we've got edges. I'm looking for a rocket. That goes here, that goes here. This goes here. What else?
Here's a little spaceship and a star.
Yep, and then I'm looking for stars here. He's an edge.
Star.
Let's see, spaceship. It looks like a dog. Yeah, this one goes here. Green.
Goodness, we're so close.
They're in the bag.
They must. I think they do.
Another one of these things.
Yeah, this star.
I think.
There.
Yeah.
We need another piece.
Okay, time's up. Put your hands up.
It's over there. There it is.
How many of you were successful at completing your puzzle?
Almost.
Almost.
Well, a
What
few-
you gave?
a couple
And what I
of
gave you.
Yeah.
Okay, well, I gave you puzzle pieces. You got most of it together. You're missing some things. Okay, so if this represents a student, let's say that this puzzle represents a student. And we have some pieces that are missing. Like when I look over here, this group, they still have some pieces missing. What I want you to do now is the paper bag that you have with your group, I want you to open that up. I don't want you to look at the side with the picture. I want you to flip it over and look at the other side, because there's some things that are written on the other side.
Look at the picture, right?
So as you look at those, what are some of the things that you see written on the back of those puzzle pieces?
You want us to read what's on the
Food, okay?
Mental health.
Mental health, what else?
Help with bullying.
Help with bullying,
brief counseling.
grief counseling,
Pregnancy prevention.
Partnerships.
pregnancy prevention,
Partnerships.
Exercise programs.
exercise programs, partnerships.
504.
504. So these are all of the things, all of the resources that in order for you to put your puzzle together, in order for that student to be successful, they need to have these extra pieces. It's not as simple as, here's your assignment, here's what you need to do, I need you to do it in this allotted amount of time. But those students have to have those extra resources in order to make sure that they are getting what they need. So now you should be able to finish your puzzle as a partner, or as partners.
Can we finish?
Yes, you can finish your puzzle.
Yay. Every me not to do that, but
No, you can finish your puzzle.
Let's finish out.
So we've got
Red.
Spider-Man.
Yes.
green.
All right.
This goes here.
yeah.
Didn't say so.
This goes. We need some blue. This one goes here.
That goes,
Are we allowed to
That's
put these
blue
over?
on this.
Okay.
Some peach
that
packs.
goes there.
See, he's an
And then
outside
this one goes
edge.
here. Eyes. Eyes.
Goes here.
It goes there.
I'm not cutting that.
He's gonna be in the center somewhere.
We get easier puzzle than everyone.
No, you didn't. They're all 24-piece puzzles.
So we're just a really good puzzle solvers.
That go there? Yeah. This needs to turn in.
Would you?
Other people might just need additional support.
Are we allowed to turn it?
We have some leaders in the classroom, so you guys can
Maybe help out.
help your classmates.
Does that fit?
Yes.
Put this up.
This has to be. Makes no sense. We're
Gotta
slow
go down the
learners.
center.
So,
None of those are in pink.
Where's the puzzle box?
that is a resource that I failed to give you, and I apologize. But what we'll do, just so that we, in the essence of time, and make sure that we can continue moving, I'll go ahead and continue on, and then if you need to finish your puzzle later, then you are absolutely free to do so. So
Slide over here.
the reason for that activity was just to have a visual of not just when you look at a student and say, okay, they need these things, but when you can't complete something, it's frustrating. Were any of you frustrated when you couldn't complete it the first time? And then the second time when you had help? It's frustrating. So when you don't have these extra resources like grief counseling, because maybe I lost my father last year, or I need some kind of mental health counseling because my father's incarcerated. These are things that children bring with them to school, and we're asking them to do all of these tasks, and sometimes they have difficulty if they don't have those resources. So when we look at Scotland County schools, one of the things that the Whole Child Pilot has done for us is allowed us to get a focus on our School Health Advisory Council. When we take a look at that whole child model and look at, okay, what are the things that we really need to make sure that we are putting in place for our students and also for our faculty, it's helped us to align and get a focus. It's also allowed us to look at what areas do we need additional support. So as we've gone through, one of the things that we highlighted on there was employee wellness. And so one of the things that we hadn't really done a lot with was employee wellness. We're so tuned into the kids and what the kids need, but we also have to understand that our teachers and our principals and our staff members, we need to make sure that they are well and healthy and able to come to school. So making sure that we were able to get that. Looking as far as our School Health Advisory Council and who needs to be at the table, because it's not just school people that need to be at the table. It's easiest to pull them in and make sure that we've got, you know, the principal there, we've got a teacher represented, we've got, you know, all these different areas represented, but who from the community needs to come in? We looked at it and said we have to have Parks and Rec here. We have to have our mental health agencies. We have to have our, you know, DSS and our health department there. It's allowed us to help coordinate services, because if there's something that we're doing specifically in the schools and we can coordinate or we can help with, you know, other things in the community. Scotland County is a small community. So anybody that's ever been there or been to Laurinburg, it's a small area. So a lot of times you see the same people on every committee, but instead of everybody going to 10 different meetings, let's just all come together and meet as one, and we can talk about all of these things at once. We've looked at the connection to MTSS. Because with that multi-tiered system of support, it's not just about the academic piece, it's about the social emotional, it's about the behavior. So being able to take this model and pull it all together. And then how do all of these areas work together? So when we look at employee wellness, are we comparing that and what we're doing for our employees? Are we comparing that to what our attendance rate is for our employees? When we look at the mental health piece, you know, what outcomes are we expecting from students if we have school-based mental health counselors within the building? So one of the focuses that we've had this year as a result of the pilot is that psychological and counseling services. That's the area that we really felt like, because of some of the things that we have going on in Scotland County, that we really needed to focus in on that area. So that's been our, when we did our needs assessment, that's been our focus, is that counseling, psychological, and social services for our students. So I can stand up here and talk about our kids all day long, but I have some students that wanted to share with you. So hopefully, Kelly, this will work. But we've got some students that wanted to share with you the impact of mental health within the schools. Do I click on that link?
Technology for this room on that needs and things.
Thought we upgraded it. We upgraded it, but it sure didn't feel like it. You take it apart.
I see some of you are still working on your
Guns aren't really the problem, it's the problem with the student's mind. When you really think about it, all these other tragedies could have been avoided if the students had someone to talk to, which is why I think mental health counselors should be available in every school, and it shouldn't just be funded by which county they're in. I believe it should be funded by the state, like the regular therapist, because they do just as much work as a regular therapist does. Yet at the same time, it's not available in most schools, and that's what's causing all these tragedies like school shootings and suicides. Because when you really look down to the numbers, when you really look down and research it, suicide is one of the leading causes of people between 15 and 34 years old. Now, suicide can be attributed to many things. It could be depression, it could be from bullying, it can be from... Hello, my name is Eric Washington, and I'm a student at Stratford High School. And if someone who's feeling suicidal, they should be able to seek help immediately. And not many schools have the resources for people to get help. Which is why we need more resources available in schools. Because in Scotland High School, we only have one mental health counselor, and she has to seek maybe 200 kids. And there's maybe over 1,000 kids at the school. And 200 is just what she has on her own personal workload. Now, imagine that there are probably way more than 200 people that deal with depression, anxiety, suicidal ideation, probably even more. You probably have people who are anorexic, they're bulimic, they're schizophrenic, but they don't show it out loud. They don't say they have it because they always have to put on this constant mask because they think that it'll show a sign of weakness or it'll show that they're weak and they need to maintain good grades. And we want mental health counselors in schools to be able to reassure them that this is something that they can't control and they can't will themselves out of it like you can heal a broken arm. It takes time, and it takes patience, and it takes the willpower to know that your mental state is just as important as your physical state. And that's why I believe that we should have mental health counselors in schools.
Okay, so that was Eric, who is one of our students at Scotland High School. And he was very excited to be able to share that. So I know you didn't hear all of it and you couldn't really see the video, but Eric wanted to share that with you. We have one more student, and hopefully you'll be able to hear this. This is Haley, and she is an elementary student.
Hi, I'm Haley, and I'm very thankful that I have a school-based mental health counselor, Miss Emily. I had a lot of anxiety, and then on top of that, my grandpa died. So Miss Emily offered me or invited me into a grief group with other kids like me who had a lot of losses. And then once grief group is done, she said that we could meet up with her again. So I did. Me and her met up one day, and I told her about my anxiety. And my anxiety would make me shake, and it would make me fidget, and it would make me not to want to watch TV anymore. And then Miss Emily helped me out a lot. That is why I'm thankful that I have a school-based mental health counselor.
I'm not doing anything until you.
Got to get this better. Gotta get this better.
Sarah, how do we do this? Okay. All right, thank you. So we talk about our compelling why a lot, and that's just two of our students. That's our compelling why. That's why we do what we do every single day, is to make sure that they have what they need. A couple more from our students. Ms. Smith really helped me with my anger issues. I had a hard time in class and couldn't work. She helped me deal with the fact that my granddaddy died. Mental health, along with suicide, is usually a hush-hush subject, but it should be the exact opposite. We need to raise awareness and support our children, and that is a girl named Summer, who is a senior at Scotland High School. Students shouldn't feel apologetic for feeling the way they do. Fear shouldn't factor into one's head when asking for help. Staff shouldn't judge a student for social anxiety or any mental illness for that matter. Mental illness is drowning in a lake, but not being able to die or survive. Asking for help is reaching your hand above the water, but putting it back down so you won't ruin somebody's day. And that's Eric. That's the same student that had spoken to you the first time. And then before, I was very sad, and she came to help me out. I didn't ask for help, but my school knew I needed some. I still get sad, but now I know what to do with it. So we have a lot of students. This is just a snippet of our students. We have, 6,000 students in our district, and we have a lot that are dealing with, trauma and a lot of different mental issues. And so we want to make sure that we are putting things in place for them, and the whole child pilot has really helped us to kind of hone in on that and work through that.
My name's Willie K. McDuffie. I'm a school nurse with Clayton County Schools.
Before you start, let me just say that at the end, we'll have some time for questions, but I do think we'd like for all three of the presenters to go through their presentations, so thank you. Clayton County.
Okay. My name's Willie K. McDuffie. I'm lead school nurse with Clayton County Schools, and I have Amy Stanley, who is our child nutrition director, with me today. Dr. Taylor's at the Teacher of the Year banquet, so the teachers deserve to have him today. So, click that for me. My stuff is not as exciting as Jamie's was. I'm the school nurse in a community where I've lived most of my life, so I think that kind of makes me very passionate about my community and the kids in my schools. It is tough being a healthcare professional in an education setting because we don't look at things through the same lens, so sometimes it takes a little longer for me to convince people to see things the way that I see them. Most educators don't look at the big picture the same way as a nurse does. And the WISC model is a holistic approach that makes perfect sense in the nursing world because we treat patients holistically. So I love the model, and I'm very grateful for having that. The WISC model provides a way for all the partners to connect their disciplines together so that we can work together. It's kind of like taking several pieces of a child, just like the puzzle that you did, which I love that, and putting it all together so that that child is successful, healthy, well-educated, well-rounded. So just a little bit about Clayton County. We're a rural community. You know, we're in the southeastern corner of the state. We have about 36,000 people in our county. And we're a Tier 1 county with approximately 71% of our children living in poor or low-income homes, and that's according to 2016 data. 28% of children live in households that are food insecure, and that's from 2015. We are a community eligibility provision participant with no-cost breakfast and lunch for all of our students. And unfortunately, we rank 95th in health outcomes and 85th in quality of life in the 2018 North Carolina County Health Rankings. Our residents are socioeconomically depressed. They have limited to no access to mental health care providers, as well as obstacles with transportation. We have 13 schools in our district, and we serve just over 4,500 students. And today's students have numerous needs and challenges that you nor I faced as a student. So we have to be creative and innovative as a team and as a community to meet the needs of our students and their families to ensure their success, which ultimately is going to strengthen our community. While Bladen County has many challenges economically, there are many positive and strengths. Next slide, please. Such as our collaborative relationships. In Bladen County, I'm going to call those wedges on the model, so forgive me if that's not the correct term. But when we meet, we have all of those wedges represented at the table. Everyone's working for the wellness and success of our students. For example, we have a Healthy Bladen Collaborative, and Jamie talks about the same people coming to the table for several things in a month. But the collaborative does meet once a month. Our SHAC does not meet that frequently, but the collaborative represents the school system, the health department, social services, county government, everyone in the community that has a stake in our students and in our community. And we discuss the things that are needed in our county, what our resources are, what programs are happening, and kind of where we can work together. Many of those people are on our SHAC and come to those meetings and help as well. And in fact, at the last collaborative, I had someone to come up and say, "Can I come to your SHAC? I want to be a part of it," which is very encouraging and exciting for more people to want to come to help for the success of our students. The Healthy Bladen Collaborative works together doing many things. They provide programming, they provide healthy eating, gardening, medication safety, numerous things. No task is too large, too small, or too menial. For instance, when Bladen County administered the Youth Risk Behavior Survey, which is something we have done in the past, but it's just a couple of classrooms maybe at a school. It's not the whole middle school district, and it's not both high schools. So I was not looking forward to counting out all those surveys and being my own administrative assistant. And I asked our partners to come and help. And no qualms about it. And I'm talking about directors and supervisors, people that are sitting at the table making decisions, also came and helped for us to administer the survey. So that's how strong our collaborative is in Clayton County. The Youth Risk Behavior Survey has provided us invaluable information, not just for our school district, but for our community. And the partners now can have a snapshot of how the youth feel about themselves, what some of our risk-taking behaviors are, alcohol use, texting while driving, sadness, those kinds of things, whether they feel safe at school, whether or not they have an adult that talks with them and provides expectations for actions and behaviors, and if they feel their teachers really care about them. It's just a few of the things we've been able to see. So having data specifically for Clayton County to compare with state and national data first helps to recognize what general trends exist among our students similar to their peers, and where we may be moving in a positive direction, and where we may need assistance or to simply change the way we are doing things. Some of our data is surprising to SHAC members, while some is not. And yes, we see trends that we would rather not, but the data provides us an opportunity for honest conversations within the community and the school of how we can make a difference for student success. What will be even more meaningful will be the ability to compare data when we do the survey again in 2019 to see where we trend with our student behaviors. Clayton County is different from the other pilot counties when comparing financial resources, and I have to say I'm very envious of the school-based mental health providers, school-based health centers, and the ability to administer the survey every 2 years independently, as some districts do. However, there are many initiatives that we are providing in our community to our students that are similar. Having the ability to talk with other districts, to hear what is working for them, how it impacts student success, provides opportunities to lay the groundwork for similar initiatives for our students. Every initiative makes a difference. What I might see as being small or insignificant really isn't. There are other districts doing similar things. Just like the WISC model takes every piece or wedge to ensure that students are healthy, safe, challenged, supported, and engaged, it takes every initiative to impact change to support this. For example, after we received our high school youth risk behavior survey, it was somewhat overwhelming to review the data. There's almost 100 questions on that survey for high school, so you can imagine what's available in that. Well, deciding what's most important, what do these things mean, how do we share this information in order to express what is important to our other stakeholders. And Sarah shared with me how they do in their county, in Forsyth County. They share an actual kind of assimilation of information for their community, which is very helpful. So we're sharing experience and helping so that we don't have to start from scratch in how we deal with these things. Benefits of being a part of the pilot is that not only is there support from other districts, but even suggestions and advice on tackling issues. Additionally, the WISC resources within the Healthful Living Wiki, specifically the monthly webinars addressing each component, they're being utilized by our teachers and our partners. They're going to that site and they're actually watching those and gathering information. The WISC for Clayton County and where this pilot participation can take us, I've had the opportunity to share the model in discussion for the wedges, what it means to our district specifically, where we may need to implement practices or a process to ensure that all students are healthy, safe, challenged, supported, and engaged. And each opportunity, I get a better insight of just how meaningful this can be for our district. Looking back a year ago as we embarked on the Youth Risk Behavior Survey, the first impression was, my goodness, this is going to be a lot of work. Imagine trying to convince principals in the month of May, we're going to do this survey this month while you're getting ready for EOGs and EOCs. Great idea, right? But of course, Dr. Taylor was supportive, and that was key to our success. Sometimes you can take the stress away from people. Just, we're going to go with it, and it's going to be fine. I always make sure when I talk about the WISC, especially in the beginning, I always was quick to say, Dr. Taylor volunteered us for this. So it's not my idea. He volunteered us. Try to pass the buck. But now I'm proud to say we're participating in the WISC pilot project, and it's very meaningful for us. As a district, we're also participating in the SHAPE pilot. We also talk about MTSS and mental health initiatives, and it just makes perfect sense with the WISC model. So we can take the wedges of the model, considering policy and practices, to demonstrate how it impacts student success. And like other pilot districts, we are using the assessment tool, which has a tab for each of the wedges, where we can compare ourselves to North Carolina information as well as national information. And then we're adding data points that we want to see for our district, for our county, as we focus our planning. We've also decided to add at the end of that assessment tool a tab to list all of our resources. What is going on in the county? What is this school doing? What is the health department doing? What is social services doing? So when we come back to our SHAC meeting to the table, we compare things and see what we already have and what we need. So we're not spinning our wheels, being repetitive and working in silos. We'll be able to use our data to tailor conversations with audiences that don't see the wedges through the same lens that maybe I do or maybe a guidance counselor does, but they will have a grasp of meaningfulness to student outcomes. So we do have to create the big picture, setting the scene for partners and participants to make changes, as well as visualizing the positives. Sometimes the focus is on what needs to be fixed, which can take away from what you're doing really well. So simply stated, it's the whole school, whole community, whole child. That's the focus. It's all connected. If we keep that focus, we can improve the success and wellness of our students. And I think it's important to remember it's not just addressing the components of the model in middle school or high school with programming or an evidence-based curriculum. Those are very important indeed, but we need to address these components the very first day that students walk into school at the elementary level. We have the tools. We need to learn how to get together how to integrate this into our education and support our students. After all, they spend most of their time at school with us. So while I dream of a school-based health center that includes mental health services, we have to remember to connect all the wedges so that everyone sees and understands the connections to ensure student success and wellness that includes the community in a supportive, challenging, and engaging environment. We can and already are making a difference with what we have available. And finally, to Jamie's point regarding employee wellness, I think that is a huge piece of this WISC model that sometimes we do forget about. Employee wellness is instrumental in student success. If our students aren't, if our teachers are not physically, mentally, and emotionally well, how can they provide what our children need? So we also have taken a look at employee wellness and are trying to implement things to support that, to be role models for our children. So what we've gained already in Bladen County by being a participant in the pilot will have a great impact on student success, and we have tools and data that will help shape implementation practices for meaningful positive change, and we're excited to continue to participate in the pilot. Thank you.
Thank you very much. And we'll move on to the big city of Winston-Salem, Forsyth, and hear what they're doing in an more urban area.
Good morning. My name is Kenneth Simon here. I'm the Deputy Superintendent in Winston-Salem Forsyth County Schools. Chairman Covey, members of the board, Superintendent Johnson in his absence, thank you all for allowing us to be here. We are certainly pleased to be a part of this pilot, and we are fortunate to have resources in our community, but being a part of the whole school, whole community, whole child pilot allows us to do something that we consider very important. I do want to say to Scotland County, we didn't bring a puzzle, but I'm going to make sure you remember that we were here. We are a city-county district. We're a little more than 50 years old. We are the fourth largest district in the state. We have 81 schools, a little over 54,000 students. Approximately 60% of our students are pre-reduced lunch. We are a really diverse district. As a part of participating in this pilot, what we've been able to do is to align this work with our 3 district goals. And those 3 district goals, the first one is to raise our 3rd grade proficiency rate to 90%. The second one is to have a 90% graduation rate by 2018, which is this year. Currently we're at 85.6. And the third is to close achievement gaps between subgroups. Students of color, students with disabilities, students who are economically challenged. So allowing us to be a part of this allows us to bring groups together. So in addition to the 3 goals that we also have 6 core values and 5 core beliefs. So I'm going to stretch you a little bit, and I'm going to say I don't have a puzzle. But one of our core values is that we are student-centered. We know that we have these outcomes for students that are primarily academic. But this pilot allows us to understand that there are other things that happen with students that require us to pay attention to them. So we also have this core belief. So we have a core value that's student-centered. Then we have a core belief that is students are at the heart of what we do. So I promised somebody that I was never going to do this again because I've done it 3 times, but since we're in Raleigh and not in Winston-Salem, I want you to take your hands, and I did this with some children at my church one Sunday. So you're going to make a heart with your hands. Everybody know how to do this? So what we do in our district is we take our core value of us being student-centered, we take our core belief of students being at the heart of what we do, and everything that we do is centered around that. That's our quick introduction. We're going to tell you about all of the things that we do, and yes, we do have school-based health centers. They do mental health. We have a lot of mental health partners. But being a large district, we still have capacity issues to meet all of the needs in the district. The person who's really doing all the work or leading this work in our district is Sarah Harmon. She's our program director for Healthful Living. So she's going to go do the details.
Good morning, everyone. Thank you for having us. As Dr. Symington said, I'm very fortunate in our district to be over the health and physical education and most things student wellness. So my role functions back and forth between our instructional services division and our student services division because we know that some things are instructional based like health and physical education and a lot of things within the WISC model and also within student wellness fall under student services. So I chair our SHAC as well, but I'm very fortunate to have the lens of a health and wellness person in our district because then I can focus all of my work on that. And I've outlined some of our points of what we have found beneficial as a part of this pilot work. I think the biggest thing for us, especially for me being relatively new to the position, I've been in education for about 15 years, but I've only been in this role for shortly over a year. And that being said, you know, this pilot started sort of right at the beginning of my journey with SHAC and with our district. And I didn't know who all of the state leaders were from DPI and from other relevant agencies to help address things that we have concerns about in each of the 10 models. And I don't know if you noticed when Jamie was speaking, but when she said Parks and Rec, I was like, Parks and Rec. So I opened the notebook and I scroll it down because I think one of the things that we're realizing through the webinars and through hearing from state leaders in each area is that none of us can do this work alone. And there are a lot of untapped resources that even the most well-intended, well-meaned, well-educated person may not think about when you're thinking about who do you draw to the table and how do you make sure that students and employees and people in your district are healthy. So I think having that state leader connection and through Kelly's webinars this year has been really beneficial for us. I think it's also been helpful for us to be more mindful of our data. We were doing a really strong job with the coordinated school health model. We moved to the WISC model the year before the pilot started. So actually using the 10 component wasn't new to us. But what we found is that as a result of this pilot, we did a lot of work and we never really measured the result. And so I think having the assessment tool that has been mentioned by several folks already where we can compile YRBS data, teacher working condition surveys, and other instruments that different people have their hands on in our district all in one place has been very beneficial for us to now look at, okay, when we're setting goals, let's not just set our goals around the work I was planning to do. Let's make sure that the work I'm planning to do is what's really a critical element in our district. And I think it's helped to have more folks looking at that data from a more critical lens about how can we really move those numbers to be better and comparing them against state and national. And we've been very fortunate that we had oversampled since 2009. Our health department is a huge partner in getting that YRBS data for us. But many times I think because it lived with our health department, the way that we utilized it as a school system was not as strong as it has been now that we're working more collaboratively. I also think it's been huge for our networking with other state leaders. I can say that I did not know, not only because of my newness, but also just because of our, different roles and different demographics and different sizes. I didn't know the folks in these other districts that I now know as a result of being in the pilot. I get ideas all the time from hearing what they're doing and what works and trying to figure it out. I think our district has been really great about being one of the first to have some of these school-based health centers. So being able to share how that helps us and how we've gone about getting funding for that and who we had to leverage in our community has been great, not only for us to re-examine our work and to be grateful for what we have, but to also try to help improve student wellness in other parts of our state, which sort of leads me into that next bullet, that, you know, when you've got great things going on, it feels good, but I think all of us don't look at the parameters of our job being the 4 boundaries of our district. And so to be able to share some of the work that we're doing so that, you know, Anson County or Bladen County or Scotland County or Iredell-Statesville County can benefit from it, and knowing that they have that same ability then to benefit with the things that they're doing, sharing with us, because we don't have it all figured out. That's been huge for us. And then the other part is we've noticed through some of this work that we have areas of weakness. We're very fortunate that as a large district, we can name almost at least one person or department that's in charge of every part of that WISC model, which a lot of districts can't put a point person on it. But what we've noticed is that we have a couple of those areas where it's more difficult for us. I'll say specifically community involvement and employee wellness, as our other folks have mentioned, just because we don't have a person in our district who is automatically assigned to that job. So knowing then how do we work within the parameters of the model to identify people who can champion for that. For us so far, employee wellness has been things related to employee well-being and mental health. We've worked with a service called Drive. Charlie Lyons and Jane Williams have been working with a school in our district to try to improve morale, because we had a lot of teacher turnover at one school in particular. And so I think sometimes with employee wellness, we think it's all about weight management. And so we've tried to look at it from a holistic approach of the employee. We've tried to leverage for community involvement some of our university partners. So again, being in a larger city, having a couple of universities, they need community experience just like we need higher education exposure. So figuring out who can be at the table. And the thing that's been great this year for us is really we at almost every meeting have had a new face at our table. Because what we found is through this networking, even in our own community, hey, we hadn't thought about having you there. You really need to come to this next meeting. And so pulling those pieces together and realizing how we all function in cooperation has been really beneficial for us.
Great. Those are some really shining examples of how well the pilots are working. I know that we have a couple of board members who have some questions or comments, and I want to get to those, but I really want to, emphasize the partnerships that you've built within your districts, but also the partnerships you've built with each other, and that's a really important, we heard a lot about silos yesterday, and this work is impossible to do in a silo. And so it's a great example, and it's one of the reasons I said earlier I'm most optimistic about this changing how we do business. We keep our model on the wall over here because it is an important way we're moving forward. And the child is in the center of this because there are no excuses, there's no blame. If a child doesn't have a great, caring adult in their lives, we still are responsible for that child. And so, that is at the heart of it. I like your heart, we'll remember that. But I want the child to be at the heart of it because it doesn't matter what else is going on. We're still morally bound to do the best we can for that child while they're with us. So I appreciate your examples, and I know Mr. McDevitt has a comment or question.
I guess it's a comment question, and Sarah began to touch on that at the end, and that is the table. Who's at the table? And I just wanted to, ask if you mentioned the IHEs, in some cases the Institution of Higher Education are at that table, but the faith community, the business community, but particularly business community in lots of ways, sharing some of their needs, but also sharing some of the workplace wellness things that are going on in some of the larger employers, but nonprofits, foundations, pre-K, all of those, as that collaborative grows, seems to me to be an important thing. Now, there are more resources and more of those in Forsyth County than there would be in Bladen County, and even fewer in some of the counties that some of us live. But bringing all of those to the table is just something I wanted to, inquire if the table is continuing to grow, and that's what I heard you say, I think, is the partnerships can grow. The other thing I'm glad Tricia mentioned silos, had some sidebar conversations about silos. Silos imply lack of, or almost willful lack of, coordination or collaboration or communication. But all silos are not equal, and all silos are not bad. So I think that in some cases there is a task-oriented, fully funded, good thing going on with good outcomes. And when I see a young lady that is as articulate as this young lady was on that video, somebody did some silo work, or work in the silo. So I want to be real clear that all silos are not equal, they're not bad. I do get it, that what we're really talking about is assuring that we have a system that is systemic and it is routine, that collaboration when needed and when it's important, and communication is there. And thus, that is the model of Whole Child. And so those 2 points. One is the setting of the table, and then the assurance of that kind of collaboration, but also understanding that some of the silo work is funded there, that forces the silo, and it's not all bad. So,
any other questions or comments?
I have a question, Ms. Willoughby. Thank you so much for your insightful presentations. My question is, what do you drive for as far as outcomes, the outcomes of your work, of your collaborations, of this model, the WISC model, of your shacks, of everybody comes together and you're leading the way and you're talking about your goals and your approaches. At the end of a year, what determines success, I guess is my question. Do you have some particular quantifiable or qualitative outcomes that you're driving for?
I think from our standpoint in Scotland is that down the road, not necessarily at the end of the year, but down the road, we want our kids to be able to go to the college of their choice or have the career of their choice, or if they want to go into the military. And we want to make sure that we are giving them the skills needed in order to make sure that that happens. So whatever it is that that kid wants to do beyond, Scotland High School or beyond Scotland Early College, whatever it is that they want to do, we want to make sure that we're giving them the skills to be able to do that. And it's not just the academic skills, but the social skills, making sure that they're taking care of themselves so that they can do that. It's not just about can they pass the EOG or EOC, but what are the things that we need to do in order to make sure that they're successful.
I think for us, we can qualitate with some data that we have already in our district. And I think some of the difficulty of this work comes around to what caused the outcome. And we know in a school year, there could be 15 things that might change in a building that it would be very difficult to say this is the thing that really moved student achievement. But I think we can look at, teacher absentee data. We can look at suspension or discipline data. We can look at student absentee data. And our hope is that with our school-based health centers as well, when we look at some of the data that they are required to generate, because they are now a federally funded, high-quality, pardon me, but I don't know their language, but now they can work with students in more billable ways, and they can look at the number of referrals and then the time that passes before the child is referred until they're seen by a mental health professional, and then they can track that individual in the school. So I think some of it is going to have to be silos of people and how we're seeing it affect those individuals, but also looking at some of the measures that we haven't always thought about looking at. That really we know. I heard an amazing principal speak at the MT3 seminar on Friday, and he mentioned that you've got to look at if your teachers are missing 10 or more days in a year, that's going to affect student outcomes. And so if we can reduce teacher absenteeism, we can hope employee wellness is part of that reason. So I think it's looking at more, and I live in a world of no data. It's sort of what you generate being in health and PE. How do you measure growth? How do you measure improvement? So I think we have to start looking at some of those things that aren't on an EBOS data scale.
Definitely, because it is not all the end goal is student success, but the work that you do, you would have to take a different pathway to get there. And you're really touching on a point. The department at the advocacy and support of the State Board of Education is beginning to look at chronic teacher absenteeism. And I heard you talk about employee wellness, and I'm sure that is, of course, that's a piece of that. So I applaud you in that regard.
And I will say, I can't speak for Scotland and Bladen, but I know one of our difficulties has been if we outsource to a community partner. So we worked with our YMCA because they were going to offer a diabetes prevention program. And our hope was that our employees would take advantage of that. One of the difficulties we're finding is that sometimes the work is difficult to track. Because of privacy regulations, we can't find out which of our employees participated in that program. So sometimes I think that's the other obstacle we're coming up against, is how do we measure outcomes in a confidential but way with fidelity. And so it's figuring out which partners can help us in a way that we can track too.
Mm-hmm. Thank you.
Other questions or comments?
My only comment is that I just finished the puzzle.
Well, we did.
Once given, so that the lesson there.
We don't know what the variable is. But it's
Well, the lesson there is when you're given all the right parts and time, you know, this isn't work that's gonna, and I didn't cue you up for that, but thank you. But it is not work that we're gonna, you know, be able to measure and see in 6 weeks, oh, we've impacted this. But it is a factor. Someone mentioned 3rd grade reading. You know, kids who are going to read successfully at the end of 3rd grade, you know, I'm going to have to put in my usual plug for pre-K. You're welcome. But, you know, that is the best return on investment that we've got going. But also addressing all these barriers to student success. You know, if you want a child to be able to read, that child has a lot of other needs coming in. And, you know, it's impossible to focus if there are all kinds of other things going on, whether it's at home or chronic illness or mental health or, you know, the myriad of things that you all are successfully dealing with. I appreciate your focus on employee wellness, because I think that is, you know, the whole reason they tell you on the airplane to put your mask on first. If you don't take care of yourself, you can't take care of anybody else, and you can't be the right role model. So that's really important. I appreciate your bringing together those, even if they're appropriate silos, you're bringing them together at one table around that child. And that's, you know, what we all want, I know. So thank you very much. And Kelly or Ellen, do y'all have any final comments? Wouldn't touch that right after we have from school systems. Yes, thank you very much for being here today. And I know being out of your district in May is hard, so thank you for being here. And Mr. Chair, that concludes our whole child.
Thank you, Ms. Willoughby. Thank you, presenters, for coming, traveling here, and appreciate the great work that you're doing in your districts.
I'm sorry.
What?
I had one final thing,
Okay.
and I forgot to bring this up, but I brought this up the last couple of months. You know, the legislature has required the superintendent, and I'm sorry he's not here, but has required him to convene a work group around student health and mental health, but not just mental health. And y'all will recall the last couple of months I've asked him about that, so I'd like to make sure tomorrow that he can tell us how that work is fitting hand in glove with this whole child work, because it is certainly related, and when that report is expected.
Okay. Again, thank you for working on this holistic approach to children and families and schools and the community. And I'm sure it's going to yield great benefits for all of us. Now we'll turn to Mr. Davis, and we would like you to introduce your topic and your presenters.
Thank you, Mr. Chair. Our topic is NC check-ins, and as we all know, for a number of years we've been exploring an innovative way to provide quick and effective feedback to teachers around how well their students are learning in order to improve teaching and learning.
It's great work on getting that.
Let's see.
having to reset the stage
All right,
here.
it's worth it.
Nothing, nothing personal.
And so once she's ready, I'll turn it over to Dr. Tammy Howard, our Director of Accountability Services.
Good morning, and while we are bringing up the PowerPoint, I will say, good morning, and while we are bringing up the PowerPoint, I will go ahead and get started in the interest of time. We're very pleased this morning to be joined by Richmond County, Ms. Kelly DeLong, and she is here with some of her colleagues. I have a few things I'd like to share about NC check-ins prior to turning it over to them.
I'm not sure your mic's
I'm not sure that's on.
Maybe switch with the other one.
Good use of resources. Somebody spent some time. I'm not sure they can use it.
Thank you. Thank you. Okay. So we are joined this morning by Ms. Kelly DeLong with Richmond County, and I really would like to give Richmond County most of the time to share about NC check-ins, but I would like to just give a brief update to the board on NC check-ins for the 2017-18 school year. One of our takeaways this morning that we would appreciate very much from the board is an indication that we could possibly expand NC check-ins to some other grade levels next year, which is the feedback that we have been receiving from our colleagues across the state. So, of course, in English Language Arts, this year we administered grades 5 through 7, and they were, of course, administered 3 times a year, and they have about 20 items on each one of those. These are the reliabilities that you can see for each one of those check-ins. And the important thing to notice here is that these numbers, the lowest is 0.75, and industry standard for reliability is 0.80. That is for a summative assessment at the end of the year that typically is going to have at least 40, 45, 50 items. To have these reliabilities for 20-item check-ins assessments is actually very commendable to our psychometric team and our test development team that are building these instruments. So we're very pleased to see these reliabilities. This is the mathematics, of course, and here you will see we were administering that at grades 4, 5, and 6. And you can see there are some difference in the item counts here across those different NC check-ins. It's important to remember that we convene North Carolina teachers to give us feedback on what we assess on each one of these NC check-ins and how many items that translates into. So part of the process is definitely to get feedback from the practitioners that are using these instruments in the field. And what you'll notice here on the reliabilities for the mathematics is they're a little bit higher. And so the question is, why are they a little bit higher? Well, English Language Arts is assessing the same content standards for reading. Reading is spiraled throughout the school year, and so NC check-ins 1 is the same as 2, is the same as 3. Whereas with mathematics, we're assessing certain content standards on each NC check-ins. So perhaps if we're assessing a content standard and it has 6 or 7 items around that particular content standard, then that increases your reliability. So it's because of the difference in the design of the instruments that one is broader, is spiraled, reading is reading. The content standards are not as distinct from one to the other, whereas in mathematics, as we all know, the content standards are very specific and very distinct. And so that's why we see a little bit different in these reliabilities. These are very impressive reliabilities, slightly higher, but very good to see, and we particularly appreciate that 0.90. And I will say, just an aside, because it's always important to share, our end of grade and end of course state assessments, we kind of raise our bar. We want at least a 0.85, and typically they are above 0.85 and in the low 90s as well. And our technical advisors are always impressed with North Carolina's reliabilities on the state assessments. So as I mentioned before, we would like to expand this based on feedback from the field to grades 4 through 8 in English Language Arts. We purposely are avoiding grade 3 with Read to Achieve because we feel like it already has a lot of different assessments and activities there. We are getting some feedback from the field that they actually would like that, but we're kind of holding off at this point as our recommendation. In mathematics, we are prepared to expand to grades 3 through 8. One question that we get is as we move forward and we adopt new content standards, which the board has recently done, and we're developing new assessments aligned to those standards, will we also align NC check-ins? And the answer is absolutely yes. So the NC check-ins will always be aligned to the implemented content standards, which of course we're also aligning to the state assessments. And we did recently have one of those test specification meetings with some teachers on Saturday, April 28th, to work out and give their input onto what those math would particularly look like. The last slides that I won't walk through, but I will just direct your attention to, beginning on slide 7, you will see that we have broken down the participation on NC check-ins by state board region. We thought you would find that interesting. The participation has basically doubled since the very beginning. This was the 3rd year, and we basically are seeing about half of the schools in the state participating in NC check-ins. But this is by state board region, and I believe this is by students, and so I'm sure you will find that very valuable information.
I just have a quick question, if I might ask. I'm wondering what the field is saying, teachers are saying with respect to the relationship of the check-ins to helping districts with pacing guides.
So the pacing guide conversation is one that comes up quite frequently, and it varies a little bit by the practices within the district and what their pacing guide looks like. And I'm sure our colleagues from Richmond County will be able to address that more directly. But we do have some who have said that there are some items on the check-ins that they're not quite there yet. Part of the discussion that we've had with them is to then see those items as a pre-test, if you will, just to see where students are, so you can still use that information. But nevertheless, you know, a pacing guide, and I'm sure our superintendent would agree, that conversation across the state of North Carolina is one that is always a little bit varied, because we don't have a state pacing guide. That is a local decision, and so building these instruments, you know, is impacted somewhat by that.
Check-ins do help the
Yes.
conversation, though.
I would think so, yes, absolutely.
So just based on that dialogue, I think I'm hearing you say that there's no individual LEA flexibility in when those check-ins are administered.
So the window is very wide. It's at least 3 weeks, if not 4 weeks. And when we have natural disasters, we tend to expand the window to accommodate with that. But the windows are very, very wide because we recognize that schools are starting at different points and they may get to that point at different times. There has been some conversation around possibly just removing that restriction per se and letting the districts use them when they're ready to use them. And so that's on our list to have more conversations. So having said that, I will turn to our colleague, Ms. Kelly DeLong with Richmond County Schools. And as I said, Ms. DeLong is the Director of K-12 Math and Science in Richmond County, and she has brought some colleagues with her as well that she will introduce as she goes along. Thank you.
Good morning, Chairman Kobe and members of the board. We want to thank you so much for having the opportunity to come here to talk about North Carolina check-ins. Hey, I got to tell you a crazy thing. At the collaborative conference, I went to Dr. Howard and I said, my name is Kelly DeLong and I'm from Richmond County and we love North Carolina check-ins. And I've got to tell you why. Crazy thing. We love them. And we love them not just from the central office perspective. We love them at the school perspective, and we love them at in a classroom perspective. So I've brought, as I always say, some rock stars for us to have conversation with regards to it, because Richmond County, just to give us a little perspective, let's see, keep on rolling, right? Okay, beautiful. Richmond County, here we are. right? If you just head down US 1 and you get to South Carolina, you blinked and you missed us. Okay, so there we are.
By the way, it's Sandhills region, too.
You got it, right? That's right, Dr. Oxendine, all of us down there together, right, Dr. Williamson? Because I'm going to tell you a little story about you, too. So here we are. We serve 7,400 students. I mistakenly call us a small district. Y'all, 7,500 students, that's a lot of kids. Okay, so we are a medium-sized district. We have 12 of our 15 schools are Title I, and we are on the 100% free and reduced lunch. Every student in our district has the opportunity to do that. We have had 3 years of participation in the North Carolina check-ins. We were one of the districts for the very first year. Hey, guess what? We got chosen. We were like, okay, what does that mean? And so what we decided to do is to say, Michelle and Angela, they'll do the check-ins. And so Michelle Davis, 5th grade teacher at LJ Bell, we knew that if anybody was going to do it right, they absolutely were going to do it right. And they were our school that was chosen for that first year. Guess what? Crazy things happened. They had great success. And even though there were angst, and we're going to use words like train wreck, we're going to use words like hot mess, and we're going to use words like anxiety, but the outcome is so beautiful for us that it really speaks for itself. So we have had that 3 years ago, we did the one at J. Bell School. We have a theory in Richmond County. We're all in, right? What's good for one is good for all, because you have to make sure that the least of thee has the opportunities of the most of thee. So we then raised our hand and said, we're going to do all of our 5th grade math, and we're going to do all of our 6th grade ELA. Donna was along with me on that, and she said, yep, we're all into with the reading. And so we chose to go all in with last year, and then when they expanded it, it's 4th grade math, 5th grade math, 6th grade math. There wasn't even a question. We kind of looked around. Like, is that a question? The testing director came down and said, do you want to do them? I was like, that's not even a question. It's a statement. We want to do them. Our conversation today is going to talk about why we're going to do this, right? We're a small district. We've got to kick it. We got to kick it for student achievement. We've got to kick it against poverty. We've got to kick it against student absenteeism. Dr. Williamson, what else? We got to kick it against teacher turnover rate. We got to kick it with you're looking at the math, science, and the healthy living department. I'm it. She's it. This is it. And so you've got to kick it. And so what you've got to do is take the tools that really smart people have developed and believe that they said you can do it and make it your own. And that's exactly what we did. So we believe in professional learning communities, and we believe in small group instruction are the vehicles that allow Richmond County to move it. Now, when we're trying to compete against the big guys, when we're trying to compete against Wade County, we're trying to compete against Forsyth County, and just trying to hang with those big kids, like we call them the varsity squad. When we're trying to hang with that varsity squad, it is the fact that we've got real PLCs, we've got real instructional leadership meetings at principal meetings. Why? Because there's only we have 15 principals in 15 schools. We're all in there together. We text each other morning, noon, and night. This one, Kate Smith, Mineral Springs Elementary School. We're texting at 10 o'clock at night, especially when the data's out, saying, what does it look like? What are we doing? That's the advantage. So how does a check-in help us? Well, a check-in helps us by giving that through grade information. We have check-in 1. We're taking a look at the data. We give it to our kids. We take a look at the data. Do you know what the report looks like that Dr. Howard and her crew has created? Have you gotten an opportunity to see one? They are awesome. It is a document that's by domain. We're talking number base 10. I know exactly what 10 questions on the test were MBT. I know what question that class of kids and that student. I get a student report by kid, and I get the test books to prove it. So the test books come back into the classroom. These are all things that you can't You can't touch that. That's the way that we do benchmark data, but now we've gotten really good questions and this fabulous report. And you know when we get it? The testing director comes in with the check-in information. We scan those reports, and they walk out with that data. Teachers are at school having a party, waiting on it, aren't they? Kate's texting me, how long is it taking you? It's been 47 minutes since she left the school. Why isn't she back yet? So that helps us to get that timely data. So we're a data-driven instruction district. Guys, that's the only way you're going to get where you need to go. What does the data say, good, bad, and ugly, and moves us toward that. We have had the opportunity to ask the questions that come from data-driven. You know what they are? All right, first one. What standards are areas of celebration? You know, when you get data, it doesn't always have to be, oh my gosh, look what, we've got to fix something. It can be celebrations. Look at this great geometry section. What a great job they've done with that. Here's the next thing. What is the data saying about who? Who do we need to help? Who do we need to remediate? Who do we need to enrich? Look, this kid knocked it out of the park. Hey, y'all, we had kids that made 100 on the check-ins. That's a true statement. They really did make hundreds. And then what strategies are we going to use to respond to that data? So a check-in helps us to do each one of those, and we're so proud. So one of the things that I want to say in this next slide is talking about the successes that I've seen with mathematics, because the check-in book itself is the gold mine. A student can take a look at the book. They can take a look at where they may have mistaken about a question. They look at in terms of just standards. We have an issue with a calculator versus calculator inactive section. Who knew? Kids really, they're somewhat effectively using the calculator. They're not 100% effectively using the calculator. Or they really are having hard time with the gridded response. And so we're really helping them with that too. And looking at kids' interpretation of visual models. So you've got the book. I've got a new layer of data understanding because we have books and we have small group instruction where kids can help with this. Donna's going to talk, Donna Gephardt. She is my bookend. She does K-12, ELA, social studies, and there's a whole big long list of other things that she does too. But she's going to talk about what she sees in the ELA realm, because it's not just math that really is the beneficiary of this.
I actually believe that English language arts is the better beneficiary of the check-ins, and I would love to see them 3-8. My teachers, when we started this journey in 6th grade, my 6th grade teachers, I started at one of my middle schools that I knew I had just rock star ELA teachers, and I said, will you pilot this for us? They were all in. They were so excited. After the first one, they said, oh, I can't wait for it to go full-blown so that we can have conversations at the district level about what we're seeing from our different schools. So the next year, as Kelly said, there wasn't a question of are all 6th grade teachers going to ELA teachers going to do it. They dove in, and the conversations about the curriculum changed drastically in how do we make sure kids are using effective strategies? What are those effective strategies? And then this year, my teachers are just loving the 5th, 6th, and 7th grade. And they're really able to dial in and say, what are our children doing that we really need to help them with reading? So one of the first things that they look at with check-ins, they looked and they realized our kids are doing a lot of fake reading. You know, everything is underlined or everything is highlighted. So one of the first things we had to sit back and say is, how do we help them read effectively? Because they thought they were doing what they thought was right. So it was very exciting to have the conversation about developing authentic readers who were invested in what they were reading, not just for an end result. Our teachers also really got to understand the complexity of complex text. One of the initiatives in the ELA world at DPI is our 12 instructional practices. And of those practices, several of them deal with complex text. And we have to expose children to complex text because they're living in a world where there is so much text coming at them at very high rigorous levels. So we had those conversations about the types of text, the teachers being able to see the types of text that their children are responding to, the effective reading strategies that I'm able now to pull a group back with small group instruction, and I'm really able to say, what was it about this question that you did not understand? it is amazing conversation that my teachers are having with students. Words that, for example, gravely. Most of us immediately get a picture in our mind, but sometimes our students don't have those visuals in their mind that they understand that that's not, even though this passage might have said gravely with a humorous laugh, they don't understand that word. So it's helping us really with some vocabulary pieces that are so critical. What I have seen with my teachers in that small group instruction where they're able to have in-depth conversations with children, and then they're moving them into those authentic, real readers. And that's so critical. I heard Mr. Griffin speak at a meeting, and he said every kid should have a book every single place they go. And I so believe that, but we've got to make sure that they're authentically reading those books. And I think the check-ins really help us to gauge how we can help our children. So in the ELA world, I can't wait for them to be expanded. I really think they are a helpful tool for our teachers and to help more importantly, to help our students, because they are at the center of this. And I'm gonna now turn it over to one of our most amazing principals. All of our principals in Richmond County are amazing, but Kate Smith is probably, I heard several things about data. Kate is a phenomenal data-driven leader. So I'm gonna turn this over to her for her to talk about her school and the data they get from check-ins.
Good morning. Thank you, Donna. That was such a great introduction. Now I'm nervous. Okay. So first let me start by saying, as an administrator, thinking about a state-created, state-mandated, local, another 3 assessments throughout the year stressed me out because the EOG is very stressful. So thinking about how I'm going to communicate that to the teachers, that we're not going to take just one big test this year, we're going to take 4 because we're going to take 3. So I say that to say in reality it was very daunting at first thinking about it, and it did create a lot of angst. And we were so thankful that we were not LJ Bell. And so, however, I will say, just like, we all have our yearly physicals, maybe we have a little anxiety before that, wondering what's going to come out. Think about everything that you could learn if you had to go do a quick one quarterly. So, just kind of that proactive approach rather than reactive and, oh my gosh, this is what happened. So it's actually been a wonderful, wonderful tool for us to take the data from and really make actionable steps to help our students grow at every single level, which is very important. So having said that, the way we use our check-in data at Mineral Springs School for both ELA and math is we create what we call strategic plans for every student, and those are based on the student reports that come in that they mentioned. Every single child in the school we are accountable for them based on those student reports. So I don't know that, or I look at my strategic plan as a teacher, and I develop, specific groups, intervention groups, enrichment groups based on standards and domains. And so, maybe Kelly and Dr. Williamson are in the intervention group for geometry standards. She made me say that. And maybe though Dr. Oxendine, maybe she's in the enrichment group. So as a principal, she made me say that. So whenever they turn in their strategic plans to me, the administrator, I and my academic coach can then look at the data and start helping the teachers make steps moving forward. And that may include, I may have to sit down and think about the processes and the structures that we have in our day. Are we losing some minutes in this specific grade level? And if we are, what do we need to do about it? Also, comparing the data across the district, I will say I always like to be number 1 at the top of the data report. However, looking at district data helps me decide, where are we in the pack? Are we at at the head of the pack? Are we in the middle, or are we at the bottom? And if we're not performing at the level that we need to, and all of our students are growing and becoming proficient, I call Kelly and Donna and ask, what are they doing at LJBL? What are they doing with this specific standard? Because we at Mineral Springs School obviously need to PLC with those teachers and the principal and figure out what are they doing that we can use at our school. So lots of collaboration with the district level leadership. Also, the students are allowed to take ownership in their learning because they do get to see their books again. So it's not something that was given to them and then taken up and they never see it again. They're allowed to look at their books and the teachers go through it, and they're looking at patterns. So the kids can actually take ownership in what they did, and they're able to talk with their neighbors and their peers about how they did. And again, they understand that their job is to grow in their learning in those specific standards. So they are allowed to take ownership with that. With monitoring those strategic plans, that allows me to be able to talk to kids one-on-one. I'm looking at specifically where our interventions, where our enrichments are. I'm able to have conversations with children. Hey, I saw how you did on, that second check-in. And believe it or not, the principal talking to a third grader can make or break, the decision about how hard they want to work the next time. And also our support staff, encore teachers, I can start monitoring. Maybe I can have them push into a classroom and maybe do some small group intervention work. So it really equips me with the data that I need to make building level decisions. Also, the sense of urgency that we have to make every second count. We say that every day at Mineral Springs, make every minute count. But the sense of urgency is Kelly's not lying when she's saying I'm texting her, like, where are the books and where's the data? Quickly, I want the data so that we can turn it around immediately. The teachers can start making those strategic plans, and we can start making steps to move forward with specific students and teachers and working our PLCs to make sure we get growth and proficiency. And that's it. Any questions before? Okay.
Dr. Oxendine?
You want to go? I've got to say, it's so wonderful meeting you at last.
I know.
Because your name comes up so frequently in my classes at Pembroke as an outstanding principal. So I want to publicly say that to you.
Thank you.
Yes, it's all about Kate Smith. So you're going to come. I want you to come to my classroom next year and talk to students. But anyway, talk a little bit about benchmarking. I'm sorry, not benchmarking, but talk a little bit about pacing guides, because that's uppermost in my mind.
Okay, so with regard to the NC check-ins, so basically, yeah, we do have our pacing guides, and I will tell you that there have been, some conversations about, oh God, I didn't get to that. Absolutely, but again, we do look at that as, a precursor to how 90% of our kids already know how to do that. So that's, whatever the skill is or whatever the domain is or whatever the standard is. So, but I would tell you that we don't really have a big issue with pacing guides and check-ins at all. If there is a lack of us being able to get there on time when the check-in is administered, it's not a huge concern or issue for us. We just know, and because the data is housed there, it's not sent off, so it's okay. It's not a major concern.
I'm gonna let Michelle Davis come up. She's got a little piece of that. She has beautiful insight on the pacing, and then we'll answer it just a little bit more, because Michelle, for 3 years, has really we've talked about how to pace.
But for the pacing, I mean, the check-ins, there's specific standards that you're supposed to teach. And so we make sure we hit those standards, and it's heavily MBT and then fractions. So we just have to kind of weave in any OAs and geometry. But measurements on there too for volume. The volume this year was on the first check-in, but it's heavily MBT and fractions.
So you just make adjustments along the way.
We do.
Thank you.
Okay, I have been a part of this for 3 years, and because I teach both math and science, and they're both tested areas, we are, as a district, we are expected to do a data analysis every time we have a benchmark or a check-in. So we're used to grabbing that data, going through, pinpointing, you know, what's our strengths, what are our weaknesses, and so we have been used to that. But 3 years ago, when we were able to get the check-in information, when it was per student, we had the sheet to send home with the parents. I mean, that took hours away, you know, that we didn't have to do because it was already done for us. So if y'all want to do it for science, that would be nice to have science check-ins for 5th grade. We do use these books because 5th grade is 52% fractions, and they can do the computation, but those word problems, after we start adding and subtracting fractions, using all those models, and then doing dividing and multiplying fractions, and then when you go back and mix them all up, they forget that you have to find a common denominator for adding and subtracting. So we spend a lot of time, I spend a lot of time modeling, reading those problems. What's that problem asking? Are we adding? What operation are you supposed to do? So we do a lot of that. And I think we create our small groups based on all this data that we're able to collect with the check-ins. The last thing is gridded response, and you just have to know the first check-in is going to look like a train wreck. It is, because this is the first year they've ever had to grid in their numerals 0 to 9, and then there's a decimal and a slash for the fraction. And so this is all new. And we spend a lot of time on this, but when you get back the first check benchmark and the check-ins, when we pull the books and we look through them, they'll have them right in their book, but it's just actually gridding it in correctly. I mean, gridding it in correctly. So that has been a big push this year. We know that that's one of our weaknesses, so we know that that's something we do all the time. Right now, we are doing in spiral review mode, even though I'm still teaching G1 and G2, but we're using gridded responses every day. I do 4. I do a spiral review, and then from that, I go around and check. I do it whole group and small group. And we even do error analysis. I'll find one that's not right, and we'll talk about it. You know, what happened. And one that I did yesterday, they used the slash mark instead of a decimal. It's just an easy mistake. And I think that's what's so frustrating. They know how to do it. It's just that bubbling in. So I think we're getting better. We're doing a lot. We're getting better. So hopefully it'll pay off in a few weeks.
Ms. White?
So are you using the data to drive what happens in the PLCs, maybe to scale up best practices? If you have a learning professional who is consistently doing well on a particular standard, and then perhaps a whole class grasps the standard, what tools are you using to replicate that? Not only in the school setting, but at the data. I think about digital tech, our digital emphasis, and could we video that educator, and then that could be used by the district, or it could be shared among teacher resources. Can you speak to that?
I can. There's only 2 math and science teachers at our school, but I'm not embarrassed to say, I mean, I've been teaching 23 years, but sometimes, I know a couple of weeks ago, I was teaching something and my kids were acting like they didn't get it. Well, our PLCs are on Tuesday at 1:05. I can't wait till Tuesday 1:05, to talk, and so I'll call Angela and I'll say, okay, my kids act like they're not understanding what's going on. What are you doing? And so we collaborate all the time. I think we have a strong team at LJBL, and even as a district, we have planning days, different team. Caitlin at Mineral Springs, she'll come. This is her first year in 5th grade math and science, so just math. So she'll come and meet with us. We have planning days at district level, and we just plan and collaborate. And we kind of paced her out because to make sure that she was on track, to make sure everything was covered. We just have a good teamwork.
And the nice thing about that with the district PLC, Caitlin, the first check-in showed that she was toward the bottom, and she's like, I'm trying as hard as I can, but I'm just so new at 5th grade. And so she reached out to Michelle and Angela, and moving along. So check-in 2, she's moving along with her students, and check-in 3, the students are moving along. And that's the essence of Richmond County, is that we're all in it together, because if you're all rowing in the same direction the whole district moves forward. And in one of the slides, we talked about the fact that we are 93% of our schools are either met or exceeds growth. And y'all, that hard work. We are no silos. I don't even know what that word means.
And to share with what 7th grade ELA did after the check-ins, they looked at who was strong in this language standard, who was strong in this RI standard. So what they're doing now is it's teacher swap. It's not just saying, Kelly, what are you doing? I get Kelly's kids, and I'm teaching Kelly's kids that standard. However, Kelly was great with Language 4A, so Kelly's teaching my kids with Language 4A. And then we're talking about it in PLCs. What did Kelly do with my kids? So that I'm able to grab that strategy for next year, but my kids are having that gap filled right now by that rock star teacher. So we're very excited about that.
I love that.
Dr. Williamson.
Yes. One of the beauties of this is that you move it from the district to the building, to the classroom, and that ownership, and that is really, really powerful. I think check-ins have done as much, if not more, to help teachers understand formative, what that really means, how critical that is, that quick turnaround, because the key is, again, not to some plan, but to the feedback. The feedback is driving everything that we do with that. So the pacing guide really would phase itself out. Waiting 90 days or some summative, well, we've been there and we know that result or that. But the key then is it impacts lesson design, and then it impacts instructional practice.
Yeah, pedagogy.
Quicker than ever. And that's critical. So it works.
Ms. Willoughby?
What I do love about what you said that I want to just make a comment on is that because we dropped check-ins into a pedagogy of small group instruction, it took it to exponentially. So using a math term, we exponentially now have the structure within a classroom to respond to the data with the books in record time. A check-in is in, out, gone, done, 2.5 weeks in Richmond County. Check, done, moving on. And so that's a beautiful thing, and it's a response a little bit every day. We don't drop and have the check-in 2 weeks. It's a little bit every day.
Ms. Willoughby.
I just want to refer back to the EY report yesterday. Recommendation 7 was align, coordinate, and potentially streamline assessments. And it talks about educators being confused. And I know we're only hearing from one district, but we're hearing from Richmond County. I'm not hearing any confusion. I'm hearing a lot of clarity about the way you do this and how helpful it is and how it impacts. And I wanted to segue with my superintendent over there. That is so important because what we're hearing is district, school, classroom, student, and it sounds like it's aligned and coordinated and working quite well.
I'm going to give you a hint where that confusion comes in.
Okay.
And that is when your central office and your testing and accountability, like my girl is 2 doors down from me. So we have conversations about what a day looks like when we're given the check-ins, and that it's not some big event, and that it's not supposed to be lock down the school, and it's not supposed to be that encore spot, and it's not supposed to be this, and it's not supposed to be. We're like, y'all, it's formative. Give it to the teacher. Let them give it in their classroom. Make sure that the data, the response to the data, we're transparent, y'all. We pull up our testing skirt and we show everybody the data. That's the way that it is. But the truth of the matter is that it's also transparent with regards to who needs help and who doesn't need help. And so it's also transparent when you have some weird accountability thing going on. Oh, it's got to be this and it's got to be this day. And I go down and I say, we're not done. We try to align. And Dr. Oxendine, we try to work our pacing around that it's friendly to the check-ins. And then we say, but if you did a testing window at the front of the window because it's convenient with you, because it was ACT week, I'm telling you, you're killing me. I need it to be at the end of the window. I promise we will be done with it and back in the boxes and back to you. And then there are things like, oh my gosh, you can't have the books with the teachers in the classroom because I got to count 37 of them. I promise you're going to get 37 back. You're going to get 37 back. We'll lock them up. We'll bring it back out. We'll lock them up. We'll bring them back out. But don't not give it to them. It's not this great divide of, I've got to hold on to these books because I can't have it. That's mindset, y'all. That's mindset. We've shifted in Richmond County, but why? Yeah, we don't have $51,000 to buy Case 21. I don't have 40 people whose job depends on making a benchmark. I got to be with teachers in the classroom. I've got to be looking at the data. Dr. Goodman relies on Donna and all the principals for us to be very transparent about that. But it's that disconnect, my friends.
I appreciate that you all have figured out how to communicate, but I am just relieved to know that Tammy Howard is not, giving y'all this mandate that's scaring you to death.
No. Remember how this went? She didn't know who to call, and I went like this. We really like them. I know we might be crazy, but we really like them.
The message isn't coming from here, and I'm teasing Tammy because I think I can, but I appreciate that it's communication at your level.
Yeah, she really is. Notice what I put at the bottom. This is my last bullet. I have to tell you, kudos to the testing and accountability services people. I have to tell you, Josh Griffin, he's my pal. I was Saturday. Do y'all know how nice it was Saturday? I was at the McCrimmon Center with the test specs. Yeah, that was hard. So we were together, but I wouldn't have wanted to be with any better people, a bunch of really smart math people who I love from across the state, getting together and saying, this is basically how the right way to teach mathematics. And we tried to put them in certain boxes, and then the psychometricians would come in and they'd kind of rattle our cage a little bit, and we're like, okay. And so we worked on it, but I worked on the test specs. And so I hope that you all will know that when those come out, it does affect pacing. But why in Richmond County we can't keep taking a test and saying, oh, well, half the stuff is on it and you all don't have to. Just pretend like you didn't know it. I mean, we've got to do better than that for our students. So I'm not so locked on a program. I'm not so locked. I've been in this 30 years. I know you can really teach geometry at the first of the year. Like you really can, if you need to. But better yet, 115 districts across the state. And as a state board, you're not going to get 150 of us to agree to anything. Right? And so everybody's going to have a different thing, so you just have to make decisions. But as a district, we adore the North Carolina Check-ins. We're all in Math 3.8. We're all in next year, and we're all in for helping to make sure that our students move along with that. And I see testing and accountability as our partner. And she didn't tell me to say any of this because I told her I liked it.
I'm crying because it's not 3.8 reading.
Yeah.
Mr. Griffin.
So a couple things. I just want to applaud the efforts of the district. To say that you have 93% of your districts that met or exceed growth is very impressive.
That's hard work.
So I want to get to Ms. Smith, and I was hoping to get my comments in when you were up at the stand. Awesome work that you're doing as a principal. Because what the presentation didn't show is that her math scores and reading scores are, specifically among students that are college and career ready, are higher than the state average. So kudos to you and what you're doing at your school. But I want to ask, are the check-ins replacing the 9-week assessments? Because I've heard you talk about, you mentioned Case 21, and I know some districts are using SchoolNet. So you're using the check-ins in place of 9-week assessments?
Oh, absolutely.
And you're not locking your buildings down
No.
to do testing like mock EOG or whatever?
I like Kelly, well, she typically says it's not an event that we do in one day and get out.
Right.
It is a process that the check-ins allow us to do, so it makes it very purposeful.
And I think it's interesting too, just to see that, the test scores, for this past year, as I'm looking at them, I mean, they're trending in the right direction. Because a lot of districts are, including mine, we have 9-week assessments that align with, the EOG. If it's 15% in 4th grade for geometry, that's what our tests reflect. So it's great to see that you're doing something different and you're getting great results.
We're this close to Hope County, just saying. We're this close. That's Freddie and his district are our metric by which we measure ourselves. We're this close, Mr. Griffin. We're this close.
It's a great bar to measure yourself.
Any other comments or questions? Dr. Howard, any closing comments?
Just very briefly, just to thank Richmond County absolutely for this presentation and for bringing it from all those different perspectives. I think was extremely helpful for me as well, and I was taking some copious notes. But also just to, as I said in the beginning, we would like to just get an acknowledgement, if that is permissible from the board, that we could continue next year to expand to those other grade levels that we mentioned. So it would then be 3 through 8 mathematics and 4 through 8 for English language arts reading.
Yeah, we're afraid if we said no, we'd feel the wrath of
Might be a lot of tears over here.
No, seriously, we wish we could bottle your sense of urgency and drink it every morning ourselves and share it with all our colleagues, because you're more than amazing. You're unbelievable. And
We'd say also collaboration, right? Because sometimes schools can see us as those people in the central office. We're not those people in the central office. We've got 2 cheerleaders in the crowd. My associate superintendent, Jeff Maples, and Ruth Bergen.
please stand. Please stand. If you're from Richmond
They have to
County.
wrangle us.
All right.
They have to wrangle us every day. Ruth is make sure. But that sense of collaboration, but the sense of collaboration with DPI also, in the math department and with Dr. Howard, with Josh, we know how hard it is, but we appreciate that they ask a little district like us, you blink and we're not there anymore, to have some input, but I really feel it from you guys too, so.
Well, you are one more shining example of what's right in public education in North Carolina and how much we depend on school districts and teachers and principals and leaders like the 4 of you.
Yep.
And it's also one more shining example of what DPI means to students in North Carolina, especially those in school districts like Richmond. Dr. Oxendine?
Just one, this will take no more than 15 seconds, just to say, let's be mindful, let's remember where this came from. It resulted from a lot of discussion several years ago about all the testing that was going on in North Carolina.
Right.
And you heard them say, no longer do we do this benchmarking because the check-ins are replacing that. So out of the work of that testing task force, remember?
Yes.
So I just can't say enough about how proud I am of this, because it's rave reviews about check-ins and the work of Dr. Howard.
Thank you. Mr. Chair?
Yeah, thank you, Mr. Davis. Thank you to the presenters. Thank you, Dr. Howard.
You here all day?
What do we have to do to sign off on expansion?
Is there any objection?
No.
Nothing by consensus.
The districts in my area all are crazy.
Okay. Well, Dr. Howard, there's no objection to expansion.
You need formal action.
Do we need formal action?
No, I don't think we necessarily need formal action.
Okay,
It's just,
without objection, so ordered.
thank you. Thank you.
Very efficient, Mr. Chair.
Please put that in the minutes.
Does the job.
Okay, it's time for lunch. Unless anybody's got anything to say before lunch. It shows that we reconvene at 1:30, but we don't need more than an hour for lunch.
Hopefully Kim will be here.
Who?
I'll tell him to make sure Kim's here before then.
Okay, all right. So somebody can get a hold of Kim Martin.
You got her?
And,
Okay.
okay, good. So
Reconvene.
we'll reconvene at 1:15.
And if you'll just leave these, I told her we'd recollect them so that she could reuse them because y'all like it so much.
There's the answer.
You already got it.
If you didn't get your puzzle put together.
Oh,